I know we've chatted before and we've talked about how you started in urban planning and then sort of evolved into the population health. And I don't immediately think of urban planning and healthcare as related, but if I take a
Right.
step back, I can certainly see how one impacts another. Would you mind chatting a little bit about that evolution and how you started?
Sure. It definitely is a little bit atypical, but given where we are now, especially post COVID, it makes a lot more sense. So, urban planners are tasked with thinking about how a community grows. So, where are we putting housing? Where do roads go? Where do parks go? Where a new school is going to be built? Where is land zoned for, let's say, a grocery store? Where are the community college? Where are the jobs located? And so every facet of a community, from where you go, where you live, to how you're going to get there. Do you have access to public transportation, walking, biking? Can you do those things for your sole transportation mode, or can you do those things just for leisure? How are we going to plan for all those different ways of getting around? And then how can we make sure that there are things like housing at different price points? We want housing to be attainable for all income levels. And of course, that's going to mean different price points, some rental housing, some homes for ownership, things like that. And so urban planning really has a lot to do with quality of life for folks. So, for example, in Nashville, it might surprise some to learn that over 50% of those who are in Nashville are actually housing poor, which means that they are spending more on their income than they should be on housing. So, about at least any of us should be spending maybe 30% tops of our income on our mortgage or our rent. But for many, that can go up to 50%, even 80% of their income on housing. So the next biggest expenditure is often transportation. So again, whether that's a car payment, whether you're maintaining your car, filling it with gas, if you're using Uber, even if you're going around by bus, transportation is one of the next biggest costs. And then food after that. And that doesn't leave a lot, especially for healthcare. So if you're paying your copays, if you're buying your medicines, and that's how we often hear about households having to make a choice between, do they purchase food? Do they purchase their medicine? And we're not just talking about some of the population. We're actually talking about a pretty good chunk of the population who's struggling. An example is about a third of Americans don't drive. And that number may seem a little bit surprising. That could be because they are either too young or too old to drive.
Mhm.
It could be because of a disability. It could be because of an income constraint, or it also could be just by choice. So if we're only planning our communities so that you can get around by car, what that means is that we don't have choices for people. And that means that a lot of folks can be homebound. They can't get to all the places they need to go. They can't get to education. They can't get to jobs, things like that. So these choices that urban planners make with the community really end up impacting our health. Of the biggest three contributing factors to preventable disease, which is the number one killer in our nation, right? It's all the chronic disease that actually doesn't have to be there, that is preventable. The largest contributing factors we hear from folks are having a roof over their head or stable housing, having transportation, and having access to food.
Mhm.
So when we think about healthcare, we often think, oh, we think of physicians and nurse practitioners, we think of prescriptions, we think of diagnoses and tests, those kinds of things. But we actually can't solve for a lot of what we're seeing in modern society from a doctor's office. A lot of what we need to be solving for is upstream from the doors of healthcare. And that's actually in the realm of urban planning, oddly enough.